Greetings. I'm Dr. Lippy Roy, and welcome to Women's Health Wednesday, Ukraine edition. As I mentioned on Monday's episode, this week's shows will all be dedicated to the health issues impacting the people of Ukraine. Today's show specifically will focus on the health issues of women in Ukraine. The reality is that women bear the brunt of every conflict, and Ukraine is no different. Thus far, the barbaric nature of Russia's invasion included the attack of 34 healthcare facilities in Ukraine, including a maternity and children's hospital in Mariupol that was destroyed in an air attack. In addition, according to the Disasters Emergency Committee, displaced women and girls are at increased risk of physical and sexual violence. The reality is that when you become dependent on others for basic survival needs, exploitation is a legitimate threat. In today's show, I will break down three categories of Ukrainian women's health issues that need immediate attention. The first is a crisis of reproductive health. According to the United Nations Population Fund, over 4,300 births have occurred since the start of the war, and over 80,000 Ukrainian women are expected to give birth in the next 3 months. The World Health Organization predicts that 15% of pregnancies will require skilled medical attention to manage potentially life-threatening complications. Unfortunately, medical supplies, including oxygen, are running dangerously low while the entire Ukrainian healthcare system is under massive strain. The majority of maternal deaths, according to Plan International, occurred during humanitarian crises. Babies don't wait because of war. Periods, endometriosis, cervical cancer, none of them come to a halt because of war. Neglecting reproductive and sexual health could have dire consequences. The second critical issue is gender-based violence. According to a 2019 UN Population Fund survey, about 75% of Ukrainian women reported experiencing some form of violence since age 15. Forced displacement will only worsen these numbers. Health consequences of physical and sexual violence include unwanted pregnancies and sexually transmitted infections such as HIV and syphilis. The emotional and psychological trauma from gender-based violence can last for months, if not years. In the coming weeks and months, psychosocial support and safe spaces to prevent gender-based violence will be crucial. The third serious issue is migrant or refugee health. The majority of refugees who fled the war in Ukraine are women. Displaced women will need treatment for acute conditions such as pneumonia, allergies, vaginal infections, or a sprained ankle. Their chronic conditions are managed as they may no longer have medications to treat diabetes, heart failure, breast cancer, rheumatoid arthritis. Receiving countries must be prepared to care for women with acute and chronic illnesses and underlying conditions requiring ongoing care, as well as the health risks associated with infectious diseases among large groups, including tuberculosis and viral hepatitis. Mental health must also be addressed in a compassionate and trauma-informed manner. I know this is a lot to process, and many of you may feel helpless, but you are not. You can make a difference. Here are a few organizations that need donations: CARES Ukraine Crisis Fund, International Planned Parenthood Federation, United Nations Population Fund, and UN Women. Stay tuned for more health videos, and please subscribe to my YouTube channel and follow my Instagram page at Health Humor Harmony Dr. Roy. Thank you, be safe, and I'll see you back here Friday, 3 p.m.